Hello everyone, welcome back to my YouTube channel. My name is Juliet. I'm a staff nurse, and in today's video we'll be talking about falls in other people. If you're struggling to hear me, I'm very sorry, and I'm going to try as much as possible for me to be audible. Rather, my microphone gave up on me. Probably my enemies are after me. So what is a fall? A fall is when there is an unintentional loss of balance, which results to a person changing their position to a lower level. So a fall occurs, maybe there is a challenge that is greater than the resident's ability to maintain their stability. You get it? So there are different reasons that a fall can occur. It can be as a result of intrinsic factors and extrinsic factors. That's big English. Basically, there are things that could make someone fall. Could be as a result of what's happening within the person's body, or external things like medications, the environment. So when it comes to falls in other people, it's not necessarily the fall that's the problem. It is the associated injuries. It is the impact of the fall. So in the UK, the largest cause of injury-related mortality, it's a fall. So if a resident fall, other people, if they should fall, what happens is they can sustain a fracture, they can sustain hip fracture, cervical fracture, a spinal fracture, and when this occurs, their mortality rate also rises, and it can easily result to death. So it's very important to minimize the risk factors that are associated with falls, because we do not want to lose our residents as a result of what could have been prevented. As people age, it's part of the aging process. There's going to be a loss of bone density. There's going to be impaired cognition. If there is impaired cognition, that means the brain function is declining. So the aged people, they have a problem with the brain, and depth perception. They might have visual problems. So basically, the brain is in charge of balance. So they'll definitely have issues with maintaining a good balance and stability. So with age, people the English is not coming. So with age, people are at higher risk of sustaining a fall as part of the normal aging process. So it's not just about the age itself. As people age, they might have chronic conditions for which they need lots of medications to manage them. So there is polypharmacy, so they are taking in more than 4 medications, which can also increase their risk of sustaining a fall. And other people to have, just as I've mentioned before, they are more likely to sustain a fall due to reduced muscles. So the muscle is not there as it was when they were young. They have a lower body mass index. They are more frail. So there is an increased clinical vulnerability for aged people. So let's talk about the risk factors for falls. We have intrinsic risk factors and extrinsic risk factors. The intrinsic ones are what is happening within the body, like the residents being over 80 years of age, the residents having functional and also impaired cognition. Functional impairment means they're unable to carry out activities of daily living for themselves, so they need support from staff members to carry out any activity of daily living, probably due to their imbalance. And the residents having mobility problems, like they have a poor gait, poor balance, their stability is not very good, and also there is a shift of the center of gravity as people age. And those things are intrinsic factors, yes. And another thing to consider is incontinence. Incontinence doesn't only refer to the resident needing support with elimination needs, like they need continence pad. Incontinence also refers to the resident experiencing urinary urgency, the residents experiencing urinary frequency, or there being overactive bladder. All those things are risk factors for falls to occur. And if a resident has had previous falls, the chances of they having future falls is very high. For extrinsic factors are more like environmental things, like let's say in probably in the nursing home, how is the lighting? Is it a good lighting? Is the floor even? Is there an uneven surface? When other people mobilize, they tend to hold on to furnitures. So if you have a situation whereby the furniture is not stable, that becomes a risk factor for them to have a fall. If you have the older residents putting on a shoe that is too tight or too loose, they can easily trip on something. Or if residents are mobilizing while putting on the dressing gown or their dressing towels, or their outfit is too long, they can trip on that. Or if the floor is wet, they can also trip on that. So those are extrinsic factors. Then we also have polypharmacy. If residents are taking more than 4 medications, they are at higher risk of having a fall. And there are certain medications that also increase the chances of residents having falls. So there are some medications that can result in blood pressure drop in older people. So residents who are on antihypertensive medications are more likely to experience hypotension. So when there is hypotension, the residents will feel dizzy, the residents might feel lightheaded, and that challenge can be greater than their ability to maintain stability. So that would result in a fall. So what happens is often residents who are on hypertensive medications, they might experience a blood pressure drop when they want to stand up, because as people age, their system rather, it's not able to, the reflexes, their systems and reflexes that controls and prevents orthostatic hypotension when we are young by causing vasoconstriction, so the blood flow doesn't uh, lead to hypertension. However, when people become old, they are more likely to experience the hypertension. And also, if residents are taking medications like oxybutynin for overactive bladder, they can also experience hypertension, because the oxybutynin will help to relax the muscles in the bladder. And the fact that it's relaxing the muscle in the bladder doesn't mean that it doesn't relax the muscles in the vessels. So it is anticholinergic in nature, the medication. So it will also relax the muscles in the vessels. So if the muscles in the vessels is being relaxed, what happens? There will be hypertension, a drop in the blood pressure. So that could also lead to the residents feeling lightheaded and dizzy, and they could easily have a fall. Also, residents who are taking diuretics like furosemide, spironolactone, bumetanide, they can also experience hypertension because of diuretics causes residents to urinate, to lose fluids, they would sweat a lot. And the blood pressure, it's about the volume of the blood, it's about the size of the vessels, and that. So if they're urinating more, they're losing more fluids, they're sweaty, so the volume of the blood is dropping, so therefore the blood pressure will also drop. Residents can have a fall when they have impaired cognition, or when they're taking medication that slows down the brain function. So opioids, example morphine or oxycodone, they can slow down the brain function. So any medication that results in a person feeling sleepy and sedated slows down the function of the brain, so they're unable to probably have a good perception of the depths have a good visual acuity, they're unable to be alert as they should be due to this medication, and that can result to an increase in the chances of having a fall. Antidepressants like amitriptyline, that also helps to deal with nerve damage, can also result in falls due to the sedating effect. So other antidepressants like paroxetine, fluoxetine can also impair cognition and increase the chances of falls occurring. When it comes to falls, there are things to consider. When there is a resident with a diagnosis of Parkinson's where they experience muscle stiffness and slow motion, they are at risk of falls. That's higher risk of falls. So we need to be mindful of those residents, and it's predictable that they might have a fall. Also because of the administration of Madopa, which is used for Parkinson's. Then another thing is with our postural hypotension, the residents, to check postural hypotension, the resident might be asked to stand up. So you check the blood pressure of the resident while they're lying down in a supine position. So it's best for them to be lying down in that position for about 10 minutes or more. Then when they stand up, 3 minutes later, you check the blood pressure again. So you don't check it immediately, you check it 3 minutes later, and if there is a drop in the blood pressure equal or greater than 20, then in the systolic reading, then it is postural hypotension. If there is a change in the blood pressure for the diastolic value, if it is 10 or greater for the diastolic value, that is also considered as postural hypotension. The systolic value is when you take a blood pressure reading, the value above is systolic. That has to be 20 or greater than 20, the difference in the lying and the standing. The diastolic value is the value below when you get the blood pressure reading. If the difference between the lying down blood pressure and the standing up blood pressure, if the diastolic value is it's 10 or greater than 10, that shows that there is orthostatic hypotension. So there is this medication called fludrocortisone, yeah, sorry. So fludrocortisone, it's a medication that helps with managing orthostatic hypotension. So it's to consider informing the GP about it and seeking advice from the GP with regards to the blood pressure differences. Also, another thing to consider is if a fall occurs early in the morning, there's the possibility of it being a blood pressure drop or risk factor. It's there. If it occurs in the evening, it can either be as a result of fatigue. If it occurs after the administration of an opioid like morphine or oxycodone, it can be as a result of the sedating effect of the medication. So maybe the medication needs to be reviewed. So in terms of medications, we always need to think about the benefits of the medication and the risk facts, the risk that the medications or side effects the medication comes with. So if the side effects of the medication outweighs the benefits of that medication, it is something to look into. Advocate for the resident. Probably the GP needs to review these medications, and that might result in a significant reduction in the risk factors of falls for a resident. In summary, the risk factors for falls differs from different residents. So what happens is, if you have a resident, you have to analyze the resident's balance, gaits, and cognition, and that would help you to determine if they're at risk of falls, if they're at high risk or low risk of falls. So following your assessment, your risk assessment, Once you identified the risk factors that could increase the chances of they having a fall, it's important to minimize it from occurring. So what do? Make sure that the residents are having a good footwear, and the footwear is well fitted, it's not too tight, it's not too loose. And also residents tend to walk holding on to furnitures, so it's important that the furnitures in the building are stable, they are not shaking. So if you notice any concerns with furnitures, you need to inform the maintenance. Concerns with lightning in the unit, you need to inform the maintenance team. If the grab bars are not appropriately fitted, you need to inform the maintenance team to repair them. And then most importantly, wheelchairs, hoists are not supposed to be in the hallway, in the corridors, or stored in an environment that a resident can have easy access to. So those things should not be stored there. You need to store them in a particular room designed for their storage, and that room needs to be locked. Also, it's important that if a resident is diabetic, they need to have a regular visual check. Every resident needs to have a visual check every year. If a resident is complaining of blurred vision, double vision, you need to refer them to a vision call to the optician to see them, because visual problems can also increase the rate of falls. I also want to mention that it's not just mobile residents that can have falls, even residents who are bed bound. So you'll be wondering, how can a resident who is bed bound have a fall? It's important that proper handover is given to care staff, and care staff are constantly reminded of residents' fall risk. So if a resident is supposed to be cared for by two carers, and then you have a care staff who wants to be a superman for the day or superwoman for the day and thinks he or she can do it by themselves, the probability of the residents falling is very high. So you need to remind the care staff that this resident needs the support of two carers, and it's important that two people go and attend to these residents for these reasons. And it's important too that during your safety checks, you check if the bed rails are functioning, are they well fitted. Sometimes the bed rails can fail, and that could result to the bedbound residents falling. Thank you so much for watching to the end of this video. If this video has been educative, can you like the video, comment, share, and please do not forget to subscribe. See you in my next video. Bye.